combating the long-term effects of wearing a mask. Hi, I'm Dr. Bobby Choker, general, cosmetic and implant dentist based here in Sydney. Come on a journey with me as I show you behind the scenes in my life and in my clinic. As we all know, we breathe in oxygen and we breathe out carbon dioxide. However, what you may not know is that by wearing a mask up against the face, you're increasing the level of carbon dioxide in your mouth. The consequences of this are the fact that you're going to build more dental plaque. Dental plaque causes gum irritation, gingivitis, gum disease, bleeding gums, a bad taste in the mouth, and then can, after that, with further carbon dioxide, solidify, which you know as tartar or calculus. Tartar is the sort of yellow thing you see in your teeth and you can't quite scrub it off. That's because it's calcified to the tooth. The only way of removing that is professionally, by a dentist or a hygienist. So today we're going to talk about routine, your oral hygiene routine, so that number one, you can prevent the build-up of plaque, and number two, if there is plaque there, you can remove it before it turns into tartar. Okay, so how many times a day should you brush your teeth? Ideally twice a day. Now, you're wearing a mask, so the situation is a bit different. There's a bigger risk of a build-up, so 3 times a day is not out of the question. How long should you be brushing your teeth? I personally prefer my patients that come here for long-term aftercare and maintenance, 3 minutes. It should really take 1.5 minutes for the top and 1.5 minutes for the bottom. Firstly, you want to brush the outer part of the teeth, and that should take a good 30 seconds. Another 30 seconds to do the inside of the teeth or the backs of the teeth, and the last 30 seconds to do the tops of the teeth, the biting surface. So that's 1.5 minutes for the top and 1.5 minutes for the bottom. Should I use a manual toothbrush? Should I use an electric toothbrush? Look, there's nothing that electric toothbrush can do that a manual can't. However, we live in an age where you've got this technology, it makes things more efficient, so why not get yourself an electric toothbrush? If you are using a manual, you want to use a medium-sized head with medium texture, not soft bristles. A lot of people think if they've got a bit of inflammation or bleeding, the natural thing to do is stay away from that. You want to do the opposite. The reason it's bleeding is because of bacteria. Getting back to technique, what you want to do is almost like you're cleaning a window. You want to do small circles going along the surface. You can do that with a manual toothbrush. With electric toothbrushes, they almost do that action for you. Number 2, flossing. Okay, everybody hates flossing. To make life easier with flossing, it's probably a good idea to buy a waxed type of floss that glides between the teeth more easily. Now with flossing, what you want to do is you want to get into the space between the teeth. So if you have 2 teeth like this, you want to get in between the teeth, you want to slide to one side and drag up, so you're cleaning one side of the tooth. You then go through into the same half again, and you push to the other side and drag up there. What you don't want to do is this sort of action. That's not doing anything. If you're having difficulty at the back, there's a couple of things that you can do. Number 1, you can use a flosser that blasts mouthwash and air through the gaps. There's various ones in the market, but the popular one is the Waterpik air flosser. That's another one. And what this does is blasts everything from between your teeth so that when you do floss, there's less debris there. Last but not least, mouthwash. Very, very important. What the mouthwash is doing is basically removing any sort of micro debris that you may have left behind after brushing and flossing. It also provides fluoride to strengthen the outside of the tooth in a topical form. And lastly, it kills bad bacteria in your mouth. I suggest you use it after your brushing and your flossing as a sort of final rinse to get rid of anything. On top of which, it makes your mouth feel great and it gives you really good breath. So, if you want more information, start that conversation. Whether it's about bleeding gums, puffy gums, gum disease, a missing tooth, whatever it may be, whatever service that you need, let's start that conversation. And therefore, we are offering a free online consultation. You can either have a chat over the phone, or more appropriately, if we can connect through Zoom or Skype, we can see each other and discuss all your needs. So click the link, book in, and we look forward to seeing you.